Hello people, in this video let us look at the factors that lead to insulin deficiency. Okay, so why insulin is less in these people? So we are not looking at insulin resistance, remember. So why do you think there will be insulin deficiency, less insulin in a person? Obviously because the pancreas is not producing enough insulin, right? So we will blame it on the pancreas. So first of all, you should know that it could be a genetic condition. So there can be single gene mutation or multiple gene mutation. So mostly you will see this in type 1 diabetes mellitus, let us say. Okay, so gene mutation, gene affected with environmental factors can be there. Okay, so basically this is one thing, genetic factors. Increasing age increases and they're not producing enough insulin. Autoimmune destruction, I think this is what we see in type 1, right? Type 1 diabetes mellitus, actually it is more of autoimmune destruction. So genetic plus environmental factors can lead to the autoimmune destruction of the beta cells of pancreas, leading to type 1 diabetes mellitus. We'll come to the details again. Pancreatic pathology, that is the pancreas is not fine, right? So it can be pancreatitis that you have, that is the inflammation of the pancreas. Pancreatectomy, that is some part of pancreas has been removed. Neoplastic disease. Pancreatectomy sounds like a full pancreas has been removed actually. Neoplastic disease, that is the cancer of some pancreas. Cystic fibrosis where there is problem with what the cilia, right? Hemochromatosis, that is something to do with the iron, right? Hemochromatosis is what? Excess iron actually. Fibrocalculus pancreatopathy. So that is fibrocalculus, some stone kind of a thing, right? In the pancreas. So this is pancreatic pathology. So who makes insulin, people? Pancreas, correct? So now pancreatic pathology only can lead to insulin deficiency. Very good. Toxins like alcohol, cytokines. So alcohol again, I'm thinking will destroy the pancreas or what? So toxins, cytokines is some immunity, some stuff, right? So they can destroy, I mean, they can cause insulin deficiency. Infections like SARS-CoV-2, that is nothing but coronavirus, COVID, right? So basically infection, this is viral, they are blaming virus. So just remember, all of this goes hand in hand, okay? One is gene, environment. Under environment, they are blaming virus, okay? So this will lead to insulin deficiency. So this is some autoimmune destruction can happen. Autoimmune destruction can happen of what? Of the beta cells of pancreas. So this, some combination of all this happens in the type 1 diabetes mellitus, okay? Then coming to glucotoxicity, that is like glucose is causing problem, is it? Is that diabetes? But this is, wait, we're talking about insulin deficiency, glucotoxicity, lipotoxicity, lot of lipids, deposition of islets amyloid polypeptide. So amyloid is some bad protein, right? So that is getting deposited. I'm guessing in the pancreas. Yes, that is the islet, right? Correct. So these are the causes of insulin deficiency, right? So people, where is this pancreas? You know, no? So pancreas, what and all is happening? That is insulin deficiency. There is some pancreatic pathology. Pancreas itself has some problem, right? Pancreatic pathology is there, or there is some toxin, or there is some genetic factor, there is some environmental factor, virus like coronavirus, there can be autoimmune condition. Then what else, people? What else did you read? Lipotoxicity, then one more toxicity, glucotoxicity, then what else? Last one was some islet amyloid deposits, right? Then what else? Wow, we come increasing age we left off. Genetic factors. Increasing age I kind of missed. Okay. Then what is this genetic? Okay, genetic monogenic. So there can be a single gene or multiple gene, right? Single gene I think is monogene, right? Monogenic diabetes mellitus sounds like that. So you have the defect of what? Beta cell glucose sensing. It's not sensing glucose, looks like. Okay, then you have beta cell transcriptional regulation. So you can read this, I think, in detail. And the gene mutated also they have given. GCK, HNF, all this you can read. Okay. What is MODY? MODY full form you need to know. Maturity onset diabetes of the young. Why is young? maturity onset diabetes of the young. Okay, so the defect they are telling you, it is in the glucose sensing. This beta cell only has problem. All the cells in this pancreas, okay, beta cell, that only they are talking about, beta cell. So many cells are there in pancreas that we are not bothered. We are going into the particular details. Beta cell glucose sensing functional defect, beta cell transcriptional regulation. So it is not able to do that transcription, translation, all that you know, no? Basics of DNA, all that, okay, protein synthesis, all that you know. So basically transcriptional regulation, that is some problem, okay. Read all the details. Now coming to type 1 diabetes mellitus, we told you this is basically immune mediated disorder. There is T cell destruction of the beta cells. Who's getting destroyed? Beta cells. Beta cell is what we need. Those beta cells are getting destroyed by the T cells. T cells are destroying the beta cells. So this is like an autoimmune condition. So it's an immune mediated disorder. So what will happen? There is something called as insulitis, okay, in the pancreas. So why this happens is because of some genes plus some environmental predisposition because of some virus, toxins, hygiene hypothesis also is there, or vitamin D also can be a cause. Let us put this as deficiency, otherwise you will think vitamin D is causing all this problem. Vitamin D deficiency in areas where there is less sunlight, okay. So low levels of vitamin D may also have some problem. They're not sure, okay, it's all hypothesis kind of a thing, okay. So what virus? We already told you about SARS-CoV-2, right? SARS, what was that? SARS-CoV-2, yeah. One more thing they are telling us, Coxsackie virus, mumps, rubella, cytomegalovirus, Epstein-Barr virus, etc., retrovirus also. So all this can cause. Then toxins they are saying like dietary nitrosamines, bovine serum albumin, coffee. Wow. So many things they are telling, okay. Children who are given cow's milk early in infancy are also more likely to develop diabetes type 1 diabetes. Okay. So cow's milk is toxin. Wow. All these are some of the reasons they think, okay. Cow's milk in early infancy, instead of breast milk, they are saying. So what crazy causes, right? Now look at this, what they're trying to say, okay, this is normal islet, beta cell mass is there here. So there is genetic susceptibility to immune dysfunction. So basically gene, and then the environmental trigger comes, then it leads to insulitis, right? So there is inflammatory cell infiltration of the islet, immune mediated beta cell destruction, auto antibodies present in blood. So you can detect the auto antibodies to what? To these beta cells, I'm thinking, right? So auto antibodies are detected. Okay, then there is loss of first phase insulin secretion. Okay, so insulin secretion is becoming less. So there is insulin deficiency. You got it, right? Okay. Do you know that in pregnancy also there is insulin deficiency? That is why that person will get gestational diabetes. Yes, that is because insulinase enzyme will become more. So what will happen? Insulin will get destroyed. So there will be insulin deficiency even in gestational diabetes. Okay. Okay, so in this video, what we want to look at insulin deficiency, the factors, the causes. Okay, that's all. I think we have covered everything. I think one thing they have not mentioned is gestational diabetes here. So just remember to write all this, okay? In the exam, if they ask you why reasons of insulin deficiency, this much you should write in the exam.